Limerick Today with Joe Nash on Limerick's Live 95 FM.
A talk on fertility is taking place in Limerick this Friday evening, which is the 27th of May. The Galway Fertility Clinic will have specialists available on the night. It begins at 7 p.m. at the Strand Hotel, and Jenny Cloherty is Chief Embryologist with the Galway Fertility Clinic, and she is on the line right now. Good morning to you, Jenny.
Hello, Joe.
Now, one listener, we mentioned that this was coming up, made contact on an interesting point. Very good friends, a couple, and they have been trying fertility treatment. They've been trying to get pregnant for a long time. However, it is now the only subject they have a tendency to talk about. And this friend, our listener, wants to be as supportive as possible, but is starting to struggle a little bit. What would you say to someone in that situation?
To the supporting friend?
Yes.
Yeah. Well, stress certainly is a big factor with all of this, and trying to anything that can reduce that. So distraction and just being a support and asking them perhaps what they would like rather than providing suggestions or advice. As long as a couple that are struggling are getting expert advice, they really don't need any other advice from friends or Google or newspapers. So just being a supportive friend, I think, through the whole process.
Yes, but when you're at the point where your own patience as a supportive friend might be wearing a bit thin, because understandably, I presume, couples can become obsessed about this.
Yes, that can be very difficult. And it is important, I suppose, that people have somebody to lean on and to be a support and, to talk to family and friends about it. A lot of couples try to keep it just to themselves, and that can add a strain to the relationship too.
Right. Does counselling help a couple in that situation then at times?
Yes, counselling can be very beneficial, either individually or as a couple, to go along at the early stages and through the process of treatment as well.
Mm-hmm. How much should people look at things like diet, exercise, stress when they're trying to become pregnant?
They're all very important factors, really, whether a couple are trying to get pregnant on their own or even if they need to resort to fertility treatment. The health of their overall body does have an impact on the health of the egg cell and the sperm cell, and they're the building blocks that we would use. So even if a couple need IVF, the better the quality and the health of the sperm and egg cells, that can improve the chances of a successful pregnancy.
Has IVF changed much? Has it developed scientifically over the years, or is it pretty much as it always was?
Oh, it has advanced a lot over the years. I'm doing this now for over 20 years, and there's been a lot of advancements. And that has been one of the challenging areas that we've had, is to identify which advancement is going to improve success rates, which ones are the important ones to implement in our clinic. And over the last few years, we have selected, in particular, using time-lapse incubators as one of the big features that has improved success rates for our couples, to the point now where we use this time-lapse incubation for all of our cases of IVF.
Let's assume that a couple is fortunate and that one cycle of treatment is enough to ensure pregnancy. How long would that last?
How long would what would last?
Would the treatment last?
From start to finish, it would be a number of weeks on medication. There are different protocols that we would tailor depending on the woman's cycle and what medication was required. But usually from start to finish, about 6 weeks to the pregnancy test.
And is it generally successful first time round, or is it something that has to go on over an extended time?
Well, it's not just IVF. So usually we would start off with a full assessment of the couple, and the consultant then would make a treatment plan, which could involve simpler treatments, first of all. Some couples only need some very basic, simple treatments. Others need to move on to IVF. And if that's the case, we do try to optimise everything so that their chances of having a baby from the one cycle are as high as they can be. That would include freezing any extra embryos from the one stimulation cycle. So some couples can actually have their whole family just from one cycle of IVF.
Okay. Now, any woman will certainly say that the process of fertility treatment is tough on the body and on the cycle. Have things become easier at all?
Well, we certainly do try to offer as much support as possible. The nurses are at the end of the phone, consultants and the lab staff as well would phone the couple every day to let them know how their embryos were developing. And just having all of that information, our couples do tell us that reduces the stress involved, that they feel very involved in the treatment and understand what's going on. So all of that would be an integral part in how we treat our patients here.
Now, Jenny, there's obviously evidence as to when the optimum time to have children is for a couple, but then the reality of life can get in the way, timings mightn't be right, stresses, etc., etc. At what stage should a couple be looking at fertility options if they're failing to conceive?
Well, first of all, I suppose there's no right time to have a baby, and that's what a lot of people are waiting until everything is ideal. We would suggest that not to leave it off till the last minute. The younger you are, the more chances of success.
And what does the last minute mean?
Well, over 37, certainly you're starting to run out of choices. So having an early assessment, even if it's only 6 months or a year of trying and it's not working, having an assessment doesn't commit you to having treatment. So it's good to get the full picture and see if there's something fundamentally wrong. And then you can get the advice from the consultant and then decide whether you want to progress, or they might be able to advise you how much more time you have left. Because the doctors can now measure your ovarian reserve, which could give a woman an indication of how many more years left she has in her fertile time.
And is there a cut-off point as to when a woman shouldn't try to have a baby?
Well, we would look at it on a very individual basis, but the chances of having a successful pregnancy do fall off dramatically over about 41.
Okay.
We would have occasional pregnancies above that age, but the couples and the woman would need to be very clear on what we can offer them.
So you don't have a specific age as such where you say, sorry, we're not going to contemplate this?
Well, really, over 44, we would be suggesting egg donation.
Okay.
That actually using your own eggs really is not going to work, and egg donation would be the best option for treatment at that point.
And Jenny, how do you deal with people who have high expectations as a result of going to a fertility clinic?
That's quite difficult, yes, managing their expectations, especially when you see in the news of women at 50 trying to get pregnant and 72, a couple having a baby. And those types of treatments really do let people into a false sense of security that they can just leave it and resort to IVF. But those are real exceptions that it would work like that, and it's usually not with the woman's own eggs. So it would be important to get an early assessment for each individual to get their picture and find out exactly what's going on for them.
And briefly, what can people expect then at this talk on fertility on Friday night in the Strand?
Yeah, well, we have another talk. We have a fertility seminar on the Saturday for healthcare professionals and GPs, and we have invited international speakers over to that. So because they're going to be in Limerick anyway, we've decided to have a public talk on the Friday evening where those speakers will be in attendance along with Dr. Declan Egan and myself, and we'll be able to give people a lot of information. It'll just be a very informal evening. There's no need to fill out any forms or anything. And the main gist of it will be to explain about what's available nowadays. And Dr. Marilyn Glenville will give a good talk on using nutrition to boost fertility, preventing miscarriages and supporting pregnancy. So that should be of interest to anybody really who's concerned about fertility or just wants to look at their options from any point of view.
Okay. Well, listen, thank you very much for talking to us about all of that this morning. It's a subject that I think interests everybody, obviously, especially couples who are trying to conceive. We appreciate your time. That's Jenny Cloherty, who's Chief Embryologist with the Galway Fertility Clinic.
Limerick Today with Joe Nash on Limerick's Live 95 FM.